Raw sewage from blocked and burst pipes flows through Glenview, a poor suburb of Harare. Rubbish piles up nearby, another source of disease. Zimbabwe's government recently declared a cholera emergency in the capital. Norman MURUNGWA has lived here for nearly 15 years. In that time, he says the abnormal is becoming normal. Every year, people get sick.
I'm very worried because the drains should be cleaned. The city council should come regular and clean all the trenches.
Some households in Harare haven't had running water for years. People who live here say it's been like this for months. You can smell the raw sewage and the houses are really close by. They say they've asked the city council to do something about it, but despite the cholera outbreak, nothing's been done. Politicians are blaming each other for the crisis. The new health minister, Obadiah Moyo, has said the opposition-run city council is mismanaged and corrupt. The opposition says the government should provide more money for water and sanitation. Harare City Council workers say they need nearly $10 billion to repair water, sewers and roads.
The funding has not been so much forthcoming, also partly because the customers who use the infrastructure do not pay their bills. The city is owed in excess of 780 million by its customers, which money, if it had come, could have gone towards the rehabilitation of the wastewater system.
This latest cholera outbreak is President Emmerson Mnangagwa's first major challenge since he won the election in July. Residents' representatives complain of corruption.
Even the pipes that have been laid underground, through corruption, they assigned their own companies with a relationship with council officials, council managers, councillors and officials in government to lay down some of the pipes. And these pipes cannot sustain the huge population that we now have. But they took away money. This is ratepayers' money and they need to be held accountable.
The government has banned stores selling street food in Harare. Some vendors are ignoring the order, saying it's the only way they can look after their families. Health workers warn if nothing is done about Harare's sanitation crisis, the number of dead from cholera and other waterborne diseases will continue to rise. Haru, Mutasa, Jazeera, Harare.